In this video, we are going to discuss about the investigations of dysphagia. The causes have already been described in the part 1 of the video. Starting with the history, the detailed history is of a paramount importance. The sudden onset of dysphagia is in conditions of foreign body, malignancy. So, if a foreign body is present, or there is malignancy, if this is a mouth, if a foreign body is present, it results in dysphagia, painful swallowing, malignancy, the cancerous conditions, impaction of food on the predisposing malignancy. So there is a malignancy which is present, and the impaction of the food on the predisposing malignancy will produce dysphagia. Okay. Then the neurological disorders, which we have already discussed in the part 1, it could be the paralysis, stroke, or the cerebrovascular diseases, and all those come under the neurological disorders. The progressive dysphagia is in cases of malignancy, and intermittent dysphagia is in spasmodic episodes. So whenever the person is having the spasmodic episode, there will be the spasm of the jaw muscles resulting in dysphagia. So these are the intermittent type of dysphagia, intermittent difficult swallowing, because the spasmodic attacks occur at a certain interval of time. That interval, so it is spasmodic episodes, intermittent type of pain is found. Okay. Investigations, continuation, the more to liquids, the painful swallowing, more it is found during the swallowing of liquids in case of paralytic lesions, whereas it is more to solids as well as the liquids in case of malignancy. And the intolerance of the acid foods is found in ulcerative lesions. Okay. What did we learn here? More to liquids. For the liquids, it is in case of paralytic lesions. It is more to solids. The solids, it is in case of malignancy, as well as the liquids, both solid plus liquid in case of malignancy. Then acid foods, the intolerance is in case of ulcerative lesions. So in the mouth, if you have ulcers all around and acid food, they have intolerance, then it is ulcerative lesions. Then you also have to note the associated symptoms like hiatus hernia, which we told that the stomach, a part of the stomach is going to be pushed up through the diaphragmatic muscle into the esophagus. The laryngeal paralysis and the palatine paralysis should also be seen. If there is a paralysis of larynx, and also the palate should also be investigated. Okay. The clinical examination, the examination of the oral cavity, oropharynx, hypopharynx, larynx can exclude most of the pre-esophageal causes. So we read about the causes, pre-esophageal, esophageal. In pre-esophageal, you have to see the before the esophagus, the contents which are found, the organs which are above the esophagus, which come before esophagus, that is oropharynx, the entire oral cavity, then the division of pharynx, oropharynx and hypopharynx, and also the larynx. These will exclude most of the pre-esophageal causes. Then when you examine the neck, chest and the nervous system, it should also be undertaken to rule out the other causes. Okay. The neck, chest and nervous system. This is the examination part. Then you see the blood examination should also be done to know the nutritional status of the patient. Then you see the radiography, X-ray of the chest to exclude the cardiovascular, pulmonary and mediastinal diseases. We saw that the tumor of the mediastinum could also be present, resulting in dysphagia. So to know the cerebrovascular, pulmonary and mediastinal diseases, we need to do the X-ray chest. The lateral view neck, it should be done to exclude the cervical osteophytes. Those are nothing but the bone spurs which are formed in the C1 to C7 vertebrae of the neck. And any soft tissue lesions should also be seen, like ulcers and so on. Barium swallow test should be done. It is useful in diagnosis of malignancy, hiatus hernia and strictures. So to diagnose if a person is having some malignancy or hiatus hernia or strictures, we have to do the barium swallow test. Okay. Let us revise. In radiography, we do the X-ray test to rule out the mediastinal diseases. cerebrovascular and pulmonary diseases. Then the lateral view neck for the cervical, see neck, so obviously the cervical osteophytes, the spurs and the soft tissue lesions. Then we saw about the barium swallow. It is done in malignancy, hiatus hernia and strictures. Okay. Then the continuation, manometric and pH studies. They are talking about the manometric study. Guys, manometry, that is a procedure which will measure how well the muscles of the food pipe are working, how well the muscles of our esophagus is working. Then based on the esophageal muscles, we see the motility. The manometry is done. How do we do this? A thin flexible tube which will contain the sensors will be passed through the nose along the back of the throat down into the esophagus. With this you can rule out the gastrointestinal reflex. Esophageal spasms are spontaneous or they are acid induced, can also be ruled out. So you see here in the picture they have given, through the nose or through the mouth we put in a thin tube which is containing sensors. With this we know how well the muscles of the esophagus are there, to know the motility, the disorders, and also the gastrointestinal reflex and the esophageal spasms, are they spontaneous or are they acid induced, can also be ruled out. Esophagoscopy. Esophagoscopy, what did we do here? The direct examination of the esophageal mucosa, and it also permits the biopsy specimens. Then and there you can collect the tissues and perform the biopsy. Esophagoscopy. With this we can rule out the malignancy. Other investigations are bronchoscopy, cardiac catheterization and thyroid scan. Let us know in detail about each thing. The other investigation we read about the bronchoscopy. What is bronchoscopy? It is a thin tube, that is the bronchoscope, a thin tube. It will be passed through the nose or the mouth down to the throat into the lungs. With this we remove the foreign bodies or the other blockages which are present. Okay. Broncho, so it is passed into the lungs. Then we also do the cardiac catheterization. There will be an insertion of a catheter into the chambers or the vessels of the heart. It is also done to diagnose the heart problems. Cardiac, to diagnose heart problems. Then we do the thyroid scan to determine any thyroid problems are there, thyroid associated. Okay. With this we come to an end of the investigations of dysphagia. Hope the video is clear. If you have any other doubts, you can put it down in the comment section. If you like my video, hit the like button and subscribe.